Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, let's see, so everything going on today, upper back pain, middle back pain, low back pain, and which knee was it again?
It's this knee.
The left knee.
Left knee.
Okay, so what's been going on?
I usually have a lot of pain like throughout my whole back. I'm not sure if it's just from my job with me standing or if it could be from, honestly, I don't know.
Okay.
But that's usually it hurts all the time.
Okay. Now you wrote down it. This has been going on since like 2011.
Yeah.
So you've been dealing with this for
It's been a while.
Okay, it's been a while. Okay. Now I know you told me you didn't really sound like you haven't gone to like physical therapy or anything like that. Now you were in the military as well, correct?
Yes.
Okay. And while you were in there, everything was good.
I mean, I had some issues with my knee, but not. It wasn't as bad, but it's been getting like progressively worse.
Gotcha. Okay. Let me have you stand up. Let's go through ranges of motion. So I'm gonna have you look all the way up the ceiling. Pain, tenderness, tightness, pulling.
No.
Good. Look down to the floor. Any issues with that?
Just my upper back.
Upper back, okay. Bring one ear to one shoulder. Any issues with that?
Tightness, but other than
Okay. And then to the other side. And then tightness with that one too? Okay. And then if you rotate either side. When you did that way, was there any issues with that one? Going to the other side. Any issues there? Okay. Let me have you bend forward at the waist. Any pain in the low back of the hips?
my lower back.
Yeah, I heard that too. Alright. I'm moving on that. When you extend back, any issues with that?
Just a little bit of pain, but not.
Does it stay in the low back, or does it actually, do you notice anything traveling down the leg?
It just stays right there. It's
Okay.
like it all just sits there.
And if you lean in on either side, any issues with that? Good. And then if you rotate.
No, but it feels like it wants to.
Okay. Let me have you lay face down. Okay. So we're going to scan the body. We're going to go from the cervical spine all the way down, checking the leg length. We're going to check the symmetry from the right to the left. So I'm just going to palpate in. Let me know if anything is tender or painful, okay? Any pain when I push in over those SI joints? Okay. Okay, just a little bit short on that left there. Hips are level. Not so level in here though. Hips are level, but through here I'm noticing a little bit of rotation, so we'll get to that in a moment. Let me grab the massage device. We're just gonna relax everything. So I know primarily it's been like right in through here, correct? So that's the most pain that you're having. Let's go ahead and get started here. Okay, we're going to start with the T3 on that left side here. Okay. Drop down to a T2 on the right. There we go. Take a deep breath in and exhale out. Good. One more time, deep breath in, exhale out. There we go, good. Still a little short on that left side. Alright, I'm going to have you sit up on the table, straddle the table, so one leg on either side. Yep. Okay. Bring this arm up and over here. Yep. And the other arm up and over here. Keep your thighs to the table for me. I'm going to rotate you this way. Look over this shoulder for me. There we go. A little bit upper. Bring it on that way. Good. There we go. Good. And lay face down again for me, please. Legs are balanced after that. Good. That's what we want to see. And we're going to drop down to the sacrum here. Raise the right leg up for me. Any pain, tenderness, tightness with that? Good. Relax that side. And raise the left side. Any issues with that?
Yeah, it's a little difficult.
A little difficult? Alright. Cross the left side. Left leg over the right. Good. Table's going to come up from below you here. Uncross. Raise that left leg up. How's that feel?
Feels a lot better.
Good. Good, good. Alright, I'm going to have you lay on your side. Face me this way. And we're going to bend that top knee. Good. Just drop that shoulder just a little. Right there, right there. Good. Flip to the other side for me, please. And bend that top leg. Perfect. Good, good. There you go. Flat on your back for me. Okay, from here, we're going to do some leg pulls, okay? So I'm just going to have you relax your legs. Let me have control here. Felt that all the way up to the hip?
Yeah, I did.
Good. Let me have you come on. Stand all the way up for me, please. And I'll have you come right here in front of me. Arms out by your side. Bring your hands over mine. Good. We're going to have you lean back just a little bit. Squeeze your elbows together. Good. And I'll have you take a seat right here. Facing that way. Okay. And bring one arm up and over. And the other arm up and over. Okay. Take a deep breath in. And exhale out. There we go. That one moved very well. Okay. And I'll have you relax your arms. Just let them rest on your stomach for me. Good. Now we're going to do that Y strap.
Okay.
So with this, and head down, you're going to feel that decompression from up top, going all the way down. Relax, relax. Deep breath in and out for me. Keep breathing, keep breathing. How would you describe that?
Like nothing I would ever have expected. It feels good, but just surprised me. How are you feeling? I'm shocked. This wasn't better.
Good. Yes, just relax, relax for me. Ton of movement, wasn't it? That's what it feels like to get your spine decompressed.
Wow. All right.
Good. Yeah, it like takes a little bit out of you there.
Yeah, it does. But it feels a lot different.
Good. Let me have you come on up. I gotcha. Alright, I'm gonna have you turn and face the front. How are you feeling?
I feel a lot better. A lot better than I expected to feel, actually.
Good. Good. Let me have you stand up. Just run through those ranges of motion. Look up, look down. What do you notice?
It doesn't feel as tight, for sure. It's mostly my back. The thing feels a lot better.
Good. I know, yeah, that upper, middle, lower back.
Yeah.
So.
That's usually the killer for me, with standing all day.
Yep. Was it worth the drive?
Oh yeah, definitely worth the drive.
Alright, guys, as you can tell at home, I mean, well, both you guys came from, quite a distance. And obviously you've seen the videos. What would you tell somebody at home who's obviously is thinking about possibly scheduling an appointment? What would you tell them?
Oh, to do it. Like, you'll feel so much better. Like, that's the only way to describe it, is you'll feel better.
Good.
It's awesome.
Guys, literally go right online, check the schedule, find the time that works for you, and I'm telling you, come on in. As you can tell, my patients, like you guys, you're the ones who get the adjustment done, and as you guys see, one thing I have in common with all my videos, is everyone is getting better once they get off the table. So there's a reason that that happens, but only way to find out, literally, come here, try it out yourself. Have a good one, everybody.